So, good morning, everyone, and welcome to our virtual hackathon to help transform perceptions of nursing and midwifery. Hello, my name's Helen Bevan, and I'm from the Horizons team, which is a national team in the NHS, which is helping to support this hackathon. And it's wonderful to see so many of you joining us from different parts of the country. So what we're doing now is we're having a launch of the hackathon, and myself and my colleague Bev Matthews, we're going to take you through the basis of the hackathon, what's going to happen, and we've got one or two special guests joining us. So first thing to say is, if you've never done this before, if you've never used this kind of technology before, if you've never been in a hackathon before, if you haven't even decided what question you're going to focus on yet, don't worry, okay? Everything is going to be fine. We will be here to support you, myself, Bev, the Horizons team, coaches, okay? Everything is going to be fine. Everything is going to be amazing. So, what we wanted to do just to get going is just to talk about how you can contribute virtually, okay? So during this session now, we're using a technology called Zoom, which is great because it enables us to talk to each other. So there's three ways that you can contribute. The first one is if you would like to speak like I'm speaking to you now. Secondly, I hope that you've been able to find the chat box. So if you go up to the top of your screen and find the chat box, then you can say hello. So what we're going to do shortly is we're going to ask you to say where you are using the chat box, and also we'd love you to tweet. So during the session as well, if you'd like to tweet, if you can use the hashtag future nursing, we'll be able to pick up what you're saying. Now, what we'd like to do is get a bit of a conversation going in the chat box. So if somebody else has written something in the chat box and you want to respond to them, so for instance, if you find that one of your friends or somebody that you know has put a welcome message in the chat box and you want to respond to that person, then if you can actually start your comment in the chat box with the name of that person. So for instance, if I want to respond to a comment made by Bev Matthews, if I actually start my comment with either @Bev Matthews or @Bev, then I can pick that up. And any questions, any suggestions that you've got after the launch, contact the hub, and we'll give you a couple of occasions on this launch WebEx where we'll tell you about the hub. So. Some of your teams have been given a coach, okay, and that's mostly the people that signed up a little while in advance and have already said what question they want to focus on for the hack. So if you haven't got a coach yet, don't worry, because we are going to allocate you a coach, okay. You can connect in via these live Zoom sessions, and there's also a telephone number there that you can call at any time if you want help, okay, which is 07717 345 798. And if I can ask my Horizons colleagues, can you also put that phone number into the chat box now, and we'll come back to that. We'll come back to that later. So the next thing we want to know is, where are you? Okay. So what we'd like you to do to practice, if you can go into the chat box now and you can put who you are, okay, and where we are, then I'm going to call on my colleague Ian in a minute or so to let us know who's taking part. So so it would be lovely if as many of you as possible can say where you are. Now I can see already that we've heard from Debbie in New Zealand. So we'd have to, in order to actually accommodate everybody who's taking part, we'd have to have a map of the whole world. So if you can just put where you are and who you are, then that will be fantastic. And I can see that it's coming thick and fast. So Bev, are you there? Let's introduce you while people are doing this. Hi Bev, can you hear me? Bev Matthews? Can we hear Bev? Hello, can one of the colleagues who are in, oh, here she is.
Hello.
Hi Bev, hello.
Hello, are you all right?
Hello Bev. Yeah, good. So if anybody's having trouble getting into the chat box, what are the instructions for getting into chat?
So if they've got any problems getting into the chat box today, they can drop us an email or text us on that number. But other than that, they should be able to get in to the chat box.
Yeah, so give us the instructions. Give us the instructions on the screen now of how to get in.
So if they click on, go to the bottom of their screen. In the middle,
okay,
they should see a chat box. So a line will click up from the bottom, and at the bottom they should see a chat box. And if they land on that chat box, the chat box will open and they can add their message in.
Okay, that's great. So find the chat at the bottom of the screen, and hopefully you can join us. And brilliant. So let's ask Ian. Ian, who are we hearing from, and where are we hearing from people?
Oh wow! So,
yeah, we can't. I can't see you at the moment, but I can hear you, so that's great. So, just keep going, Ian. Yeah, I can see you now. Very good.
Great. So, see Nottingham University, Cummings, Hannaway from Manchester. We've got Colin from Together Foundation. Bournemouth have joined us, and also a representation from Blackburn.
Also great, and there's lots flashing through as well at the moment.
Yeah, so Ian, I don't think your microphone was working, but it is now. So can you just tell us again who's joining us from where?
Okay, can you hear me now?
Yes.
Brilliant. Okay, so we've had lots of people join us. Nottingham University Hospitals have joined us. We've had a hello from Colin at Together Foundation Trust in Gloucestershire. Hello, Colin. A good contingent from Blackburn. I've seen Bournemouth come through, Bradford, Manchester, Derby, all over the place, and it's really good. Great. People have certainly found the chat box.
Yeah, that's lovely. And also what's nice is we've got some New Zealanders who have joined up, both in New Zealand and in England. So really welcome everybody. So that's great. What we're going to do now is we're going to go to our first poll. How do you feel about taking part in this virtual hackathon? And we're going to give you two different potential four different potential answers. Okay, so you can choose. The first one, I'm very positive. I'm excited about what we might do over the next 2 days. The second one is I'm cautiously hopeful that we can make some useful things happen. The third one is, oh, I'm anxious because I'm a bit scared of the technology. And the other one is I'm willing to give it the benefit of the doubt. So I think Pardeep is going to put a poll up for us. Okay, can everybody see? Can everyone see that poll? And what we'd like you all to do is to click a box on the poll and submit it. And again, if you're having trouble seeing the poll, if you just put a note in the chat box, we'll see you. Great. And we're shortly going to see the scores. Pardeep, who's doing that? Who's running the poll for us? Can you see what's happening there, Pardeep? Can you tell me what's happening? Do you want to unmute?
Hello,
Hi,
Helen.
Pardeep.
Hello, Helen.
Hi.
Yes, I certainly can. So we've had a very good, positive number of people that have voted. We've had 25 people that have said that or 25 groups, I should say, that have said they're very positive and excited about what they're going to be doing over the next 2 days. 3 people or 3 groups have said that they're cautiously hopeful about the things that they can make happen. 2 groups that said that they're anxious about the technology, and nobody has said that they're willing to give it the go for the benefit of the doubt.
Okay, that's great. So most people are really, really positive. And the people that are anxious about the technology, don't be anxious, because honestly, we'll support you. And I hope when we do this again, you won't feel you won't feel anxious. There we are. The scores have come up. So 83% of you have said very positive. I'm excited about what we might do over the next couple of days. Brilliant. Let's move on. So I'm very pleased now to go live over to the RCN Congress in Belfast, and I would like to going to have two speakers. First of all, we have Professor Jane Cummings, the Chief Nursing Officer for England, and Jane is also going to hand over to Catherine Hannaway, who is the Global Campaign Project Manager for a fantastic global campaign for nursing called Nursing Now. So the first thing I want to do is check that Jane can hear me. Jane, can you hear me?
Yes. Hi, good morning, everybody. I hope you can hear me okay, and welcome to everybody joining. I'm in Belfast at the RCN Congress, where there are hundreds of nurses today. So there may be a bit of background noise. Really, really pleased that you've all been able to join us. But before I say anything more, I'd like to hand over to Catherine Hannaway, who's going to talk about the International Nursing Now campaign and how that aligns with what we're doing.
Great, thanks very much, Jane. Hello, everybody.
Yeah, good morning, Catherine. It's great to see you.
I'm the Acting Global Campaign Director for Nursing Now, which is a programme of the Burdett Trust for Nursing and is run in collaboration with the World Health Organization and the International Council of Nurses. And it's aimed at raising the profile and status of nursing worldwide. So I'm delighted to be here in Belfast at the RCN Congress, because the RCN are really strong supporters and partners of Nursing Now. And in particular, to have the opportunity to talk about how the perceptions of nursing and midwifery campaign in England, that we're going to hear much more about this morning from Jane, is so closely aligned to the global Nursing Now campaign. The Nursing Now campaign aims by 2020 to influence universal health coverage, communicable and non-communicable disease, and other global health policy, to promote and develop nurse leaders at the highest level in leadership, advocacy, and policy making, so that they can drive forward these important changes, as well as nurses and midwives on the front line to be skilled in leading innovative change. We hope to create and identify and disseminate research and evidence on the impact of nursing in terms of prevention, promotion, and treatment, including in the areas of mental health. We'll disseminate and share effective practice. That's stories, it's case studies, it's what you're doing this morning here, and all about such initiatives. We have over 40 countries now linked in with Nursing Now, so we want to share this across the world. The agenda on universal health coverage, non-communicable diseases, and the Sustainable Development Goals presents nurses and midwives everywhere to really step up with a huge opportunity to be advocates and let policymakers and others know just what a vital role we play in the world and worldwide, and especially here in the UK, on these global and difficult issues. The hackathon that Jane will describe in more detail now, and Helen has already talked much about, gives a perfect opportunity for nurses, midwives, and their supporters everywhere, really to step this forward into that worldwide agenda. For those of you here at Congress today, you can hear more about the Nursing Now campaign later today at 5:45, where we're running a session, and just find out how you can get involved with that important campaign journey. So I wish you all the very best of luck with your hackathon. Get hacking, so they say, and to Helen and the rest of the New Horizons team for all their support to strengthen nursing worldwide. I look forward to meeting as many nurses and midwives here at the Congress as I can, but to you all, the very best of luck.
Fantastic, Catherine. I wish we could give you some applause, and I hope that everybody.
Thank you, Catherine. And this is certainly doing on the hoof, as it were, moving the microphone between us. But I think that really highlighted the importance of what we're doing in England around transforming perceptions, with also the International Nursing Now campaign. So to get to what we're doing today, obviously Helen has given you quite a lot of the technical expertise and a lot of the technical knowledge, but I am absolutely delighted that we've got up to 50 teams all across the country, and in fact some internationally. So if any of you are joining us from India or New Zealand, where I know you've expressed an interest, you are very welcome to our virtual hackathon. We already have around 240 nursing and midwifery ambassadors who have spent the last few months really describing what made them want to become a nurse or a midwife, describing their stories, and actually really supporting our Perceptions campaign. They have already been talking to children and young people, to MPs, to their local teams and their local colleagues, really driving home what makes them a nurse, what nursing and midwifery is all about, and helping us to transform people's perceptions. So the first ever virtual hackathon builds on some of the work that's already been done. We've had thousands of interactions with people over the last few months. We've done sort of local hackathons where people have worked together in teams, but this is the first time we have actually done something that is so virtual, that spreads across the country. And I think it'll be a really interesting way to try and gain your views, your thoughts, your expertise, your ideas. Because at the end of the day, if we really want to change people's perceptions and we want to make nursing and midwifery the most important professions that people come into and stay in, it is people like you that are doing the job day in, day out, that understand what it means to be a nurse or a midwife, that are the best people to be able to describe it to everybody else. So your challenge over the next couple of days is to produce a short 2-minute film, which can be based on one of the following 3 questions, which I think you all know, but I will just repeat them. So the first question: how do we ensure nursing and midwifery expertise is at the heart of shaping future healthcare policy? The next question: how do we get the media to reflect and promote nursing and midwifery as desirable professions? And the last question: what systems and or networks could we build to improve the way nurses and midwives connect, communicate, share and learn from each other? So 3 really interesting topics that we are absolutely desperate to hear your thoughts on. I know many of you may not have done a virtual hackathon. I certainly didn't, and I had to look up what a hackathon was the first time the team talked about it. But you've got expertise and you've got support, and I'm very, very pleased and proud really that Helen and the team for NHS Horizons have been so committed to helping us with this. There is expertise, there is coaching, mentoring, supporting to help people to be able to really make a success of this. Your nominated team captain will be the point of liaison, and they will have received a briefing pack and will have allocated within their own team what people's roles will be. And at the end, we're going to look at all of the information you send us, and one particular team will be picked as a winner, although I'm guessing that you will all be winners in your own right. What we've done is we've organised for the winning team to come down to London. We'll support you to do that. We've had an offer from one of the Lords in the House of Lords to show you around Parliament, so to give you an opportunity to go and have a look in Parliament and see how that works. We'll also do some coaching time with me and other senior leaders, and we'll also support you to be able to write this as a blog for the NHS England website and through the nursing press. So some real opportunities to really highlight and identify what you've done, and to thank you for all of the work that you're contributing to making this a fantastic reality. So as well as the hackathon, I also wanted today to announce the launch of a series of 12 30-day challenges. There's going to be 1 challenge a month, and we're starting next month in June, and we're going to keep going until May 2019. Each of those challenges has been built on feedback and ideas that you have told us about, that the people that have been involved in our campaign so far have highlighted are really important. So we've had some amazing input from our crowdsourcing platforms and all of the work we've done so far. So these challenges are designed to generate a sense of really significant national energy, some camaraderie amongst our professional teams, and also how people can support each other. They're designed in a way to enable individuals and local teams to be involved, to think about those challenges, to interpret them in a way that's important for them, and then to give us some feedback about what's been relevant and how they've wanted to take those forwards. Nurses and midwives as professionals have just so much talent, so much energy, so much potential, so much expert, compassionate care that you do day in, day out in whatever setting you work in. This is a really good opportunity for us to use those challenges to really drive forward the changes that we and you have told us you want to see. I won't go through them. You might well be able to see them listed up on the screen behind me. But please do take time to read those, to think about them, and to take part in doing those 30-day challenges when they come out. So I'm going to hand over back to Helen. I'm in Belfast, Helen's in Coventry. Helen will take you through the next 2 days in a bit more detail. Like Catherine, I wish you all the very best. Thank you so much for taking the time to be involved. I know that you're all incredibly busy, and the fact that you've taken the time to do this, to give us your time and your thoughts and your expertise, I really appreciate. Good luck, and I look forward to seeing the results of these 2 days. Thank you very much.
Oh, Jane, really appreciate that, and also Catherine as well. And I just think, for everybody who's taken part, whether you're a winner or not, there's so many opportunities here. Come and be a nurse ambassador. Come and get involved in nursing now. I feel just so positive, I think, about some of the opportunities that are here. So let's carry on with our virtual hackathon and getting prepared for it. So the next thing we're going to do is, what we want to do is just get a sense from you. As Jane said, there's 3 different potential questions that you can answer. So I'm going to just tell you about this. We're going to put a poll up now. And what we want you to do is to tell us, have you as a team already decided which of the questions that you want to focus on, or haven't you decided yet? And if you haven't decided yet, it doesn't matter, because we'll help you to do that, and we'll get you a coach. So Pardeep, can you put the poll up? Okay, so if you see the first 3 answers are the 3 different topics that we're focused on that Jane read out. So tick one of those if you've already decided to do one of those, or if you haven't decided yet, can you tick the 4th box? While we're doing this, I'm going to go back to Ian, if that's okay, and ask Ian to tell us what's happening in the chat box. So Ian, can you hear me?
I can. Can you hear me?
Yes.
Brilliant.
Loud and clear.
Just thought I better check this time. So lots of waving going on, particularly from Wolverhampton, who are waving to everybody just to say hi. 1 or 2 people are asking about the briefing pack and making sure that that's sent out to them. So we'll make sure we do that after this session. And people are just generally getting used to using the chat box, Helen. So it's all going well so far.
Excellent. That's great. And Pardeep, how long will it be till we get the answers? Should we wait for them to come on the screen? That's okay. Are they calculating now? Here we go. So most of you have already decided, and it's quite an even split, so that's fantastic. So 23% of you have said you're going to focus on the question around how we make sure that nursing and midwifery expertise is at the heart of shaping future policy. Okay, 32% of you are going to focus on the media question. 32% of you as well are going to focus on the question around the systems and networks to improve the way that nurses and midwives connect. And 14% of you have not decided yet. And that's fine too. And as soon as this launches over, we will help you to do that. So thank you everybody for contributing there. So let's carry on. So Jane said in her talk that she didn't know what a virtual hackathon was and she had to look it up. This is one of the first ever virtual hackathons in the NHS. We have lots of hackathons, but this is very new in terms of being a virtual one. So a hackathon is an event or a place where people come together for a short period of time and they collaborate on a practical project, they build something to test, and hopefully they create some breakthrough ideas and thinking. Okay, so that's exactly what we're going to do. And this is a virtual hackathon, which means that the space where people are going to come together is a virtual space. Okay, so some of you are actually taking part in the same physical space and are beaming in virtually, and some of you are actually operating as a virtual team. Okay, but what will happen is throughout the 2 days, today and tomorrow, you'll be connecting virtually using the Hackathon Hub. So let's just go through the event calendar for the next 2 days. And I'm going to have Bev ready as well, because Bev, who is our event director, who's been organising everything for the virtual hackathon, I'm going to ask you to unmute Bev so that you can add anything you want to add at all. Okay. So Bev, can you hear me?
I can, loud and clear, yes. Yeah,
lovely. So we're now, this is the commencement of our hackathon, and then we're going to, at 1 o'clock, there's an opportunity for you to check in. Okay. Do you want to say anything about that at this point, Bev, about the check-in?
Yes. So that check-in will be a general check-in for everybody, just to see how you're getting on, any common themes that have been coming up in the morning, but also we'll break out into the different question groups, so you'll have a chance to meet the other groups who are doing the same question as you and exchange ideas and thoughts as to where you might be able to help each other and support each other.
Great. So what will happen at 1 o'clock is all the teams that are doing the media question can have a chat with each other, and all the teams that are doing the policy question can have a chat, and all the teams that are doing the network question can have a chat with each other as well, and just find out what each is doing. Yeah, that's fab. Yeah, and then at 5 o'clock, what we want you to do is to submit the first cut of your video and your little film and get some feedback. Again, Bev, tell us about that.
Yeah, so this is really an opportunity for you to test the technology. We won't be publishing the videos anywhere, so they can be as rough and ready as you like, but it's an opportunity for you to make sure we can access what you're uploading and that you know how you're uploading it. So when we get to the final cut submission tomorrow, it's all smooth and simple, and we managed to hit the deadlines.
That's great. And then between 5 and 5:30 and 8, we've got the advice clinic open. So between those times, you can come and take part, you can get advice. And if you've got time, I would recommend coming and taking part in the advice clinic, because there's a lot of people there that can give you some really good help. And it might make the difference between you being the winner and not the winner. So I'd say use all the help you can. Then, anything you want to say about the advice clinics, Bev?
No, I mean, we might pick also out of the check-in at 1 o'clock. We might, give you some advice that, joining in the advice clinic might be helpful. So it might be throughout the day you make that decision, not necessarily have to make it now. And it will be available in there if you suddenly have a panic moment at 6 o'clock tonight. We'll be there and able to speak to you.
Yeah, and the other thing is we will help you. Yeah. We will help you all the way. So if you're struggling with a certain technical thing, we'll get some people to help you. So we're going to keep an eye on everybody, and you'll have your own coach, and you'll have the wider team there to help you if you have any difficulties. So don't worry, you're not going to get left alone in this. So then tomorrow morning we're having an early bird check-in. So tell us about that, Bev.
Yep. So we'll open the Zoom up at 8 o'clock in the morning until 10 o'clock. It will stay live for all of those 2 hours. And when you and your team are ready to get hacking again, you just log in and come and say hello to us here at the Hackathon Hub in Belfast.
Yeah. And the great thing about this, you don't have to, you can just come in, say hello, and then go. We're not expecting you to stay for 3 hours with the advice clinic tonight, and we're not expecting you to stay on the check-in for 2 hours tomorrow morning. It's quick, it's in and out, and we'll help you in other ways as well. An important time is at 11:30 tomorrow morning. We will ask you to submit the final cut of your 2-minute film, okay? And within half an hour, we'll get them all, they'll all be on YouTube, and you'll be able to view your film and everybody else's film. And then what's going to happen is we will identify 4 teams, okay, to be the finalists. So things may end for you at 1:30, or they may carry on, because if your team is identified as one of the 4 finalists, we'll give you some more time to do some more work, and again we'll give you some help with that. Okay, at 3 o'clock we've got a presentation to our judges. So Bev, tell us about the judges. Who's on our esteemed judging panel?
So we've got Paul Vaughan, who is our lead commissioner for this work.
Yes, so Paul is the director of he's the director of nursing for Transformation at NHS England. That's right, isn't it?
Yes, yeah.
Brilliant.
We've got Wendy Preston, who is lead link for the perceptions work in the RCN.
Brilliant.
And we've got Michelle Mello, who is the National Clinical Director, also a nurse for personalisation in NHS England.
Lovely. Right, so those are our 3 judges. Brilliant. So then at 3 o'clock, what we're going to do is ask the teams, the finalist teams, to give a short presentation to the judges, and we're going to do that on Zoom, aren't we? So that everyone else who wants to can see that as well.
Yeah, we'll do it on Zoom. We might live stream it on YouTube as well.
Yeah, so even if you don't get picked to be one of the 4 finalists, you'll still be able to watch the finalists give their presentation either on Zoom or on YouTube. And then I'm going to announce the winning team at the Mona Gray lecture at the RCN Congress in Belfast tomorrow night. And what is that being live streamed as well, Bev?
Yes, that's the plan. Yep. So we'll make sure certainly that the final 4 can zoom in, but our hope is to live stream it on YouTube.
Okay, so the key timing is 1 o'clock today to just check in and have a conversation with the other teams that are doing the same question as you. If you want to, okay, you can take part in the advice clinic anytime between 5:30 and 8 tonight. Okay, we'd love you to check in the morning, sometime between 8 a.m. and just after 10. And again, it's just a question of just checking in, coming and saying hello. Okay, key time 11:30 tomorrow morning is to submit the final version of your video, and we'll let you know at 1:30 if you are one of the finalists. And then if you are a finalist, you'll be presenting at 3 o'clock. And if you're not a finalist, come and listen anyway. And the winning team will be announced at 5:45 tomorrow night. So, wow, a lot happening. So, Bev, tell us about the Hackathon Survival Guide.
So on the platform that we've been using for the whole of this programme, we've created a dedicated space just for teams taking part. So all of you over the last few weeks have been working with us to get access to it, to make sure that you can get into that space. I know some of you haven't quite got in there yet, and we will work with you over the next hour to make sure that happens. And it's full of information that you will need to help you to shape how you're going to create your pitch. And it's got things around how to craft your personal narrative, how to create storyboards, how to do video editing with lighting, and also the workbook of the templates for the hackathon.
Great. So, Bev, can somebody from the team put the link into the chat box as well? So, for anybody who's having difficulty, you might want to go on. You might want to go on now.
Yeah.
So, yeah, brilliant. Thanks for that, Bev. So, okay, part of this is 3 templates that we would like you to fill in. Okay, now these templates, they're there to help you, and they're not mandatory, but we would like to see them. And I know some of you are going to get more time as a team to spend doing this than others. So you know, if you don't get it done, it doesn't matter. But we would love you to work in this way. So I'm just going to briefly take you through the 3 things that we would like you to fill in, as well as making your film. And what will happen is these, you know, filling these in will help you with your film. So the first one is just is to understand some of the ideas that you've looked at, because what we want you to do is to come up with a lot of different ideas to start with before you home in on one idea. So on this first template, we want you to list the members of your team, and also to come up with a name from your team. And then question number 3 there, which challenge have you chosen? So have you chosen the policy challenge, or the social media challenge, or the nurses and midwives connecting and networking challenge? And then I'm just going to tell you how number 4, we want you to come up with a lot of different ideas, and we want you to plot them. And then number 5, we want you to think about the impact. So let's look at number 4 first of all. What we want you to do ideally is, for your challenge, first of all, to come up with a lot of different ideas, okay? Because there's a lot of evidence that says if we think divergently, big brainstorm first before we think convergently, when we focus in on, you know, 1 or 2 ideas, we'll come up with better ideas. So what we want you to do is you can do this with Post-its, you can do this however you want. Have a go at coming up with a lot of different ideas, and then plot them on this grid. So you can see these Post-it notes here. So so what I want you to do is, obviously, the ideas that are going to be the best ideas, can you see down one axis it's how hard is it to do, and the second axis is how big the change is. So obviously the changes that we'd like to see the best or most of are ones in box 1 that are very easy to do and are on our big breakthroughs. So the ones that we don't want to do are ones that are in box 5, which is hard to do and don't bring about much change. So you know, ideally, what we want you to do is to be coming up with, to first of all, just brainstorm a whole load of ideas, and then plot them in this box as to where you think they are. And you know, the very act or process of doing this means you'll come up with more ideas. So the first stage, you know, come up with a load of ideas and plot them on this box, okay? Then, if you see number 5 here, it says impact. Explore the impact of your big breakthrough ideas that hopefully are in box 1 or 2, and think about them from 3 different perspectives. So think about them in terms of like me and my role. And again, this one here is focused on the challenge that's about the media. Okay, so for me, the impact is if we undertake this project, this will develop me as a leader and help me to develop new skills in communication, which is fantastic. Okay, and then if we take the impact the next level up, again, the media one, it's about creating a more positive environment for teams of nurses and students to work in, and also because this person people filling this in are in a hospital environment, to create more joy at work on the ward. But it could also say in my GP practice, in my nursing home, you know, whatever context. And then the biggest level of impact is me and my profession. Okay, so if we implemented this change, what would we do? The public would see the different roles of nursing, and people would stop feeling sorry for us. Okay, so what we want you to try and get done is to fill this template in, to brainstorm some ideas, to plot them on the template, and to pick the one that you want to work with, and to work out the impact. Honestly, it doesn't take very long to do. Okay, the next thing we want you to think about is to designing your campaign. So having picked the one breakthrough idea that you want to work on, and assess the impact of it, we want you to design your campaign. And again, what we want you to do here is to tell us about your campaign. Okay, so the theme that you're working on, your campaign, how would you describe it in a nutshell? And then we want you to actually design a campaign for your idea. Okay, and what we're doing here are want to think about three things, okay? Actionable, connected, extensible. And I'm going to show you a couple of examples. So the first thing is, okay, let's look at this. It needs to be actionable. It's like, what action do you want people to take? So your idea, you know, we want to make a difference. So it's about what action do we want people to take, and who do we want to take that action? Okay. The second box is connected. Who will we need to involve to connect to and influence? Because what we want is an idea that will promote a closer connection with people that you care about or share values with. And again, it's like, how do we connect with other nurses? How do we connect with students? How do we connect with young people? You know, how do we connect with the media? And the idea of connected, it makes you feel part of a community and it creates spread. And then the third point here is E, extensible. How can your ideas be easily adapted for other teams to use? Okay, until I learned this ACE framework, I didn't know what extensible meant, but it's like the word extend and making it bigger. And it's the idea that you've got a basic idea that you've come up with, a common stem, but then other teams can take it, they can remix it, they can customize it, they can reshape it. So I'm just going to show you a couple of examples, kind of famous ones around using the ACE framework. So the first one I've picked is end PJ paralysis. And I know many of you are taking part in the 70-day challenge that started on the 17th of April to give patients back 1 million days of their precious time that otherwise would have been wasted with them wearing night clothes in a bed, in a hospital, or in a care home. Okay. Now, the thing about hashtag end PJ paralysis is actionable. In a sense, there's some really clear things that people can do. So, you know, here we've got the end PJ paralysis challenge, and what we're doing, the action we're taking is we're looking at how many patients are up and moving before midday. And here we can actually count it. We can actually count the action around how many patients we got up and moving. Okay. The next thing about end PJ paralysis is the C. Okay, it's connected. If what we've got here is some Twitter data for hashtag end PJ paralysis, and it's a little bit complicated looking, but what it basically tells us is people all over the country are connecting around the Twitter hashtag end PJ paralysis. So each like little group of circles that you can see there, that's a set of ideas that are spreading and spreading. And if you look very importantly at the green lines, just how many green lines there are, and those green lines are the ideas spreading between communities. And that's what we want to be able to do with your ideas. You know, we want loads and loads of green lines. And I know for those of you that are in other places, you can't see this very well, but what it's basically showing is that end PJ paralysis is spreading all around the world in an amazing way. And the other thing about end PJ paralysis is it's extensible. You know, here we've got Cambridge University hospitals, we've got Lancashire teaching hospitals. We're taking the basic ideas, we're creating our own posters, we're making it our own. Here is an extensible poster for the 70-day challenge, where we've dressed up a cat. You know, are we telling everybody across the country they have to dress up a cat? No, but this team has chosen to. That's extensible. Okay, loads of teams are having days of action in support of end PJ paralysis, where they're dressing up in night clothes. And again, you know, it's all part of being extensible. So think about how can you make your idea actionable, how can you make it connected with other people, and how can you make it extensible. And just one more really quick example, which is the theatre cat challenge. And again, you know, we know that in patient safety, massive problems in terms of knowing who people are, okay, in the team. So surgical staff started to put their names on their caps, okay, and again it started to spread. It started in Australia with a fantastic surgeon called Rob Hackett, and it's now spreading around the world. And it's extensible. So here are 3 ideas for it being extensible. So the first one, at Derriford Hospital, what they've decided to do there is to have a different cap colour for each kind of job. So Gemma here is an obstetric anaesthetist, so they have green caps. And here the the next picture on the top right hand side, they're putting their names on the side. And the bottom right hand picture is actually from Stanford in the USA, and they're having the Theatre Cap Challenge, but obviously in US American spells theatre differently than British American. So they call it the Theatre Cap Challenge, spelt differently. So and that's extensible too. So just think about that. So how could you develop a campaign for your idea that is actionable, connected, and extensible? What we'd love you to make your film about is the basic idea, some of the impact, and to show how you can create a campaign that is ace. Okay, so that is your challenge for today. And Bev, would you like to add anything here? Hi, Bev. She can't hear me because she's got her, I can see she's got her headphones off. Somebody who's with Bev in Belfast, will I tell her to put her headset back on? That's great. Okay, so, and again, here's an example here, which was the idea was to create a Nurse of the Year campaign with local newspapers, and we're setting out how actionable it is, how connected it is, and that it's extensible. And Bev has got her headset back on now. So Bev, anything else you'd add at this point?
No, I think that sounds great, but I think the idea is to really be creative and really stretch yourself, and look beyond the traditional or the normal, and work together collaboratively and learn from each other. So I think this is a real opportunity to just think differently. Fantastic.
Yeah, and there's no such thing as an idea that is too big or too innovative or too creative. And I think, again, the more I think the kind of idea that's going to win is an idea that's really big and creative, but that's been really well thought through in terms of how we can make this real. So after that, okay, the last template that we're giving you is a storyboard. And again, your coach can help you with this, but what we want you to basically do is creating your 2-minute film is to just draw it out as a series of steps, and actually creating a storyboard, okay, will really make a difference in terms of how good your film is. Okay, and again, with the films, the idea of the films is, okay, we're not expecting professional filmmaking capability. In fact, it doesn't, you won't be judged on how technically great your film is. You'll be judged on the creativity of your ideas, your energy, and that you've thought it through. So I'm just going to give notice to Ian that we're just going to ask him to do a quick review of the chat finally. So hopefully Ian's on standby. And again, just to say, any problems you have during the day, get in touch with the hub. Okay, most of you have got a coach now. Those teams that haven't got a coach, we're going to get onto that with you straight away. Connect into the live Zoom, and again, we saw the timetable before, so we know when the live Zoom is going to be happening, and the Zoom is going to be happening at 1 o'clock and at 5:30 till 8, and it's going to be open again tomorrow at 8 a.m. And if got any difficulties, any questions, please call into the number. So Ian, I'm going to give you the last word, if that's okay, in terms of what are we seeing in our chat box.
Okay, really keen in the chat room at the moment. Mainly people are using it to ask questions around the technology. We've posted in there, you'll note, the link to the Hackathon Resource Hub. So please, everybody, please do pick that link up. We're also asking those teams that haven't yet had an allocated coach allocated to them, please stay on the Zoom session afterwards and we'll allocate those up. And there's a nice comment from Dom from the Horizons team around the quality of the videos. We're not expecting Steven Spielberg type quality, just some good and interesting videos at the end of the day.
Brilliant. Thank you, Ian, so much, and thank you, everybody. So, wow, I hope what we want this to be more than anything is a really interesting, joyous opportunity where you learn some new skills, and you meet some new people, and you take nursing and midwifery forward. That's really, what this is about. And we don't want you to feel horribly pressurized at all. So for those of you that haven't had a coach allocated yet, can you stay on, the Zoom? Everybody else who's already got a topic and who's already got a coach, get hacking, and we'll see you again at 1 o'clock. So very, very best of luck, everybody, and enjoy, and I'll see you later.
Brilliant. Thank you, Helen. I have to say, here at the Hub in Belfast, it's absolutely buzzing. It's just gone electric because the whole of that session was streamed on YouTube. And we've got people in front of me signing up to be ambassadors as we speak. Jamie's being mobbed by people about hackathons. So we've got some teams joining from here. So very exciting. So we'll just give those who are leaving and know what they're doing and where they're going a few moments to log out. And then we can start to help those of you who are still left on the line, and we need to add into a group. So I'm just trying to see where they are. Okay, is that any better, Catherine? Am I speaking to a really muffled? Okay, all right. So I'll look like I'm whispering in a school playground, but as long as that's better, that's good. Okay, so still got 38 registered. So I'm just going to go down. What we've created is a super group for those of you who are single and ready to mingle as a group on a hackathon. So I'm just going to go down the list in the order of people as you registered, and then we'll attach you into a group. So Debbie, can you unmute yourself and we'll have a quick chat and link you in. No, okay, so Debbie's in New Zealand, and Debbie, I'm going to link you into the super group, which is with Tony, Ofra, Gina and Helen. So as soon as we come off this line, I will link you by email, if that's okay. So as long as you're happy, I'll link you by email, and then we can move forward. Struggling to see how to get to everybody. Pardon, can people unmute themselves?
Hello. Hello.
Hi, Bev.
Hi.
No, participants don't have microphones enabled in webinar, so
Well,
they can communicate on chat.
okay, I'll really just talk to you then.
Hello.
So Debbie will link you into the super group. I'll just ask Dom if you wouldn't mind making a list of these decisions, and then I'll ring Dom and we'll go through it. Colin? Difficult to work out how to get these across. But Colin, I think you're linked with Lee, so we'll come back to you and hopefully see it. Debbie, we haven't had any correspondence from you, so I'm not sure if you're a team or an individual, but could you...
Hi Bev, it's Pardeep here. I'm just going to let you know, I have the ability to unmute people in the attendance section, so if there is anybody that you want to speak, just let me know, okay?
So much easier. Okay, so can Debbie speak? Debbie Fisher.
Hello.
No? Okay.
Hi, hi, it's Phoebe here.
Hello Deb, we can hear you loud and clear.
Great.
Hello. So
Yeah,
I
can hear both of you, but
I can hear you, Debbie.
okay.
We can hear you, Debbie. You just need to start speaking.
Yep. Hello, Debbie Fisher here.
Debbie, I can hear you. It's very
Oh,
quiet.
great.
I can hear you. So we'll link you with Opera, and I think you've just linked by email. So Tony's in charge of that group. That's you sorted. Is that okay, Debbie?
Great. That sounds good. Thanks.
Okay, good. And we'll try and work with your hours as well. Not full night. Thank you. So Debbie McCall, Debbie Cromack, can we speak to you? Harvey, just unmute you.
Hello, Bev. I'm struggling to hear you over there. Who did you want unmuted?
Debbie Cromack. So this might be probably too complicated to do on. Okay, so I think this is probably too complicated and too noisy this end. It's really noisy here now. The hub is absolutely rammed and packed. So what I'll do is suggest we come offline. Dominic's just suggested I find a quiet space. It's the break time, and there is just nowhere in this building. So thank you, Dominic, but I just don't think we're going to find anywhere. So what I suggest is come offline, and I will email the lead of each team, or if you could ring me on the 07717 345 798, and let's get you all cracking rather than trying to keep battling with the technology at this noisy time. So we'll call an end to this session. Thank you very much, everybody, for joining in. And I will work my way down the list and be in touch with each of you and link you. And if you haven't heard from me within the next 10 minutes, then please give me a ring. Not yet, no.
Good morning, everybody that is joining us on the hack. It looks like we're just having a couple of technical issues as we're struggling to get someone from Bev at the moment. But what we're going to do is we're going to just disconnect for the next 10 minutes, and Bev will be sending out invite links to the right coaches and connecting with you individually. If we need to reconvene, we'll send a new link. So we're just going to end this session for now, and then we'll get some emails out in the next 10 to 15 minutes.
All right. Still in a bit of trouble. My friend gone.
Okay, so we'll leave it at that, and we'll come back to you on email and phone call for the next 10 to 15 minutes. Thank you, everybody that has currently joined us. We look forward to hearing from you shortly. Thank you, everybody.